Welcome to the Yin Fang podcast, where we explore the power of holistic health, food as medicine, and the practices that keep us and our family thriving. I'm Whit Farr, a board certified dental specialist, and I'm here with my wife Heather, a holistic health coach. Together, we've learned firsthand how nourishing food, mindful movement, and natural practices can heal, energize, and elevate our lives.
As parents of 3 young boys, we're committed to keeping our family healthy in the most natural way possible, from what we eat to how we care for our bodies. Join us each episode as we dive into holistic health, oral wellness, and the mind-body connection, sharing tips, stories, and expert insights to help you lead a balanced, vibrant life. So take a deep breath, settle in, and get ready to discover the power of whole body wellness with us here on the Yin Fang podcast. This episode is brought to you by Yin Fang toothpaste. Yin Fang toothpaste is a 4-ingredient toothpaste with coconut oil, baking soda, cacao butter, and nanohydroxyapatite. It's non-toxic, there are no preservatives, it has low abrasivity which preserves your teeth, it supports your oral and gut microbiome, and it's remineralizing. We ditched the tubes to help the planet, and instead, Yin Fang comes in a sustainable zero-waste packaging and delivery system. Get yours at yinandfang.com. All right, we are here today. So excited with our first guest on the podcast, Lauren Colletti. She is a nurse practitioner certified in functional medicine, board certified in functional medicine, And I think we're going to kind of go all over, but really kind of focus on what functional medicine is today. So why don't we just get started with telling us who you are, what your background is, just a little bit about yourself.
Yeah, so my name is Lauren Colletti. I'm a family nurse practitioner and certified by the Institute of Functional Medicine in functional medicine. So my passion is really about holistic health and really understanding the why of health issues. So what I learned early on in my medical training was that a lot of the tools that we have in kind of traditional medicine is very much looking at symptoms and then trying to fix those symptoms. Whereas when we try to do that, oftentimes those symptoms, when we correct them, they create more symptoms, oftentimes based on the treatment. And so really I kept getting curious about, okay, why are things happening? Why aren't people talking about nutrition, like lifestyle, relationships? And as a nurse, I'm trained very much in a holistic model, which what does that really mean, holistic? It's looking at the person as a whole being in an environment. So we are not separate from the environment we live in. And as we know, like the environment that we live in is critical to our stress levels and our health. And so we have to take that to an account when we're looking at the person in front of us, right? If someone is living in poverty, that's a hugely stressful environment for them. Therefore, the treatment and what we might talk about is going to be different. Yeah. And so I kind of had very much of a traditional training, but my background as a kid and in my college years, I was very much athletic. I was a college soccer player, so very like health-minded, physical health-minded. And then I learned more about nutrition, and really during training wanted to learn how to keep people out of the hospital, because hospital care, my clinical rotations and residency was in hospitals, so ICU, surgical, cardiac. And what I found is it's just a hard place to be, not only for the patient, but also for the healthcare workers, really. And I was pretty much set that I wanted to keep people out of the hospital. And so I learned about pretty dissatisfied with traditional medicine, just giving pharmaceuticals for every symptom and having 5 minutes with people didn't really give me enough time to like learn about them or learn how to support them other than just handing them a prescription. And so I found out about integrative and functional medicine. I mean, acupuncture, Eastern medicine is something I was introduced to early on. That didn't feel like the right fit for me. And then I found out about functional medicine. So that's what I've been doing for the last 13 years.
Yeah.
Oh, wow.
Yeah. And you've done a kind of a combination, right? Where you worked in kind of a family practice. and then were on your own for a while, right?
Yeah, absolutely. Yeah. So I like the core of my experience is in family medicine, which is, primary care as we know it. You're sick, you need a physical, you go to your primary care first. And that was wonderful. And it's a great place to introduce education. And so I was working in kind of an integrative practice that we sort of tried to move to a more functional medicine focus. So integrative is very much Western, but trying to integrate other modalities. And then functional medicine is really about, it's a systems biology approach. So you're looking at the body as, made up of a dynamic system made up of parts that are all interconnected. And so our body is trying to be in balance. And so when you look at the body as a whole system, you understand how all the parts kind of interact and the importance of that. And so that's a pretty foundational to functional medicine.
That's pretty interesting there, listening to you talk about it. So far we've kind of covered like a traditional Western approach, and then you mentioned integrative, and then functional. You kind of see those all as different types of practices. Like, and especially for me, the difference of the integrative to the functional that you just made was kind of a new.
Yeah, functional medicine is a newer modality. I think integrative has been probably around a lot longer. Functional medicine was really spearheaded by Jeffrey Bland, Pollack, Mark Hyman, right? So those the sort of big in the foundation of the Institute of Functional Medicine, which is a training program for clinicians to learn how to practice functional medicine. But there's a lot of similarities. It's literally different verbiage, different words to mean, really looking at the person and integrating different modalities, not just the tools that we learn in sort of the allopathic or Western med approach. Yeah.
Got it. And just to go back on that, it was 13 years total, and then we described the 3 different practices you did. And then when did you switch into the functional? Like, how long was that?
Yeah, so I got board certified in functional medicine, I think in 2016.
Okay.
And I was practicing kind of integrative and doing lots of training, but I didn't fully get certified till then. So I learned a ton doing family medicine and integrating and learning hormone replacement therapy, thyroid, gut health, adrenal health, and doing different types of testing. It was just in the family practice type environment that I was in. It was still an insurance-based model. So we were very limited on the amount of time still we got with the patient. So it felt very much like an in and out, like a drive-through of like giving them definitely more information, but never really feeling like I was able to kind of full circle, because I was seeing so many patients a day and didn't really get enough time to like really understand their story, which is such an important piece of functional medicine, is that initial intake where we really do a history timeline. We create this timeline from when you're literally in your mom's womb till now. And when we ask the right questions and listen to the story, it really highlights areas that can, precede or trigger certain issues that are going on now. Because as we know, most health issues, unless we're, in an acute injury or an accident or need an emergent surgery, most issues are issues of chronicity. So things have been going on for a while before the symptoms oftentimes manifest.
Right.
And that's really where understanding the history is so important. So while I was able to do a lot through a good question, I didn't get a lot of that back history, which as I would see people repeatedly, even after a year, something would come up. Oh yeah, I lived in a moldy home. I'm like, oh, well, that makes so much sense, So it definitely I really ended up deciding to start my own practice so that I could really truly practice functional medicine the way I felt most aligned with. And also just, it burned me out completely seeing so many patients a day, like 17 to 25 patients a day. I was doing, we were doing sick visits and physicals, but it was a very, very, I learned a ton, but it's not sustainable for life and mommyhood. And I had 3 kids. So it was.
Yeah. So that's an interest, just to like give a little background here too. Like, we know Lauren from being neighbors years ago. So we know
one of the first people we met in Austin was
your
family. I mean, we just moved and y'all moved in right next to us like right away.
Yeah. So we have a familial connection. So I think we have the perspective of seeing kind of like how this is practiced in your home, as well as, seeing you as a practitioner, just like seeing patients and stuff, which we can kind of get into, because I think when you're in the functional space, you look at the body in a different way. And so you react, well, it's preventative, but also you're reacting to symptoms that you're seeing in a different way than someone that is used to trusting and relying on the allopathic, kind of the Western medicine system. So in talking about that, I kind of want to like get your perspective on the two systems and how you see them kind of working together. Like you were saying, in your family practice, it shifted from kind of the allopathic Western and then kind of took on this functional approach, but you're still using insurance, and it's kind of, it was the same kind of like quick through seeing patients quickly, that kind of a model versus like the functional approach, which is a lot more time with people.
Right.
And focusing on, what are the underlying things that are causing the problems, rather than like, what do you have going on? Let's stop that thing that's going on. So, how do you kind of see the two systems? Like, I think there's somewhat of a resistance for people that are new to functional medicine. It's like, well, we've only known this other way. So are you saying this way is bad, or we can't use it at all? Or is there a space for the two? Like, how do you see kind of Western and functional, how do you see their roles?
Yeah.
And is there a place for both?
Yeah. I mean, what I would love to see, and I'm seeing movement slowly towards that, is, I mean, the functional medicine model should be standard of care. It really shouldn't be an either or.
Yeah.
Unfortunately, there's a lot of the systems, insurance system is not supportive of functional medicine or spending time with patients, because that's how they're reimbursed. And so we have to think about it as a business, right? So it's a business of healthcare. Unfortunately, everything is, people are looking to, but it impacts barriers to people getting access or even thinking about accessing it, because they can't use their insurance.
Right.
And so the reality is that insurances are getting worse and worse, and care is not getting better.
Right.
And people who are in the insurance-based model are really struggling to, it's not the docs aren't making an insane amount of money, I can guarantee you, right?
Yeah.
Certain even surgeons, that they do make, it's at a high risk, and the insurance company is making a majority of that, right?
Yeah.
And it's not a talk about that, but just to bring clarity to that, there's no bad or good here.
Right.
It's really just two different models.
Mm-hmm.
The idea is that we really need to educate our healthcare workers on a more integrative, holistic lens, at least, to look beyond just symptoms and what medicine I can give you. And I do feel like, in general, people in healthcare, I mean, they go into it to help people, right? And however it happens, it can come to where we're not really helping people, and they're dissatisfied because of that. And so the number of people who reach out, who are working to me, is like, how do I get into functional? I really am so wanting to transition to this type of care. Mm-hmm. And so to me, the people are wanting it when they understand that it's available. So it's an understanding that there's another way.
Mm-hmm. Yeah.
And it's oftentimes baby steps. We can't approach someone who's new talking about peptides and, all of these advanced therapeutics. We need to meet them with, okay, let's just start with, how are you, eating in a day? Like, are you drinking water? Are you getting regular sleep? Are you on your phone all the time? Do you move your body? Are you eliminating regularly? Are you pooping every day? Like, the number of people who don't eliminate regularly. And so it's really just, instead of jumping to advanced protocols and all the supplements, which I use a ton of, you have to meet people where they're at. And I think definitely within the functional world, people don't necessarily get that. Mm-hmm. And they're starting to kind of overwhelm, and then it gets really expensive, and people are like, oh, well, that's just too much. I just can't do that. I'm just going to go back to taking pills.
Right.
Right.
That's so interesting. And I think that is the sentiment that I sense from a lot of people that are having health issues, or they see somebody else is healthy and they say, I want to get healthy. And then it's this, how am I ever going to do all these different things. It's this
Mhm.
overwhelming feeling.
Yeah.
That is one of the biggest
Any
barriers.
lifestyle change, I mean, any changing of habits, things like that, there's like, it's a lot to it, and there's resistance. And so you got to keep it simple, stupid. Like, it's definitely,
Yeah.
you have to do that. And it is an investment in your health. Like,
Mhm.
insurance keeps everything, that you don't feel like you're paying money. But in reality, if you see how insurance is billing for the things that you're getting, you'd be like, shit, it was $300 for that 5-minute visit. That's not worth it, right? Whereas I could put that money to a clinician who, upfront, there's always an upfront cost with functional medicine because we spend more time with you, we get more testing. But the idea is we're really teaching you to not need us.
Yeah.
Right.
Like, I
Right.
want to empower you and educate you. I mean, you have to empower yourself. You have to take accountability of your health. But when you start when you're given the information, the tools, and it's digestible, and you start noticing the simplicity of some of it and the results with it, then you start buying in, and you're like, more and more. I mean, I'm sure you guys can attest to just your own personal experiences, right? And so that's really how you get people to understand.
Yeah.
Because it's sustainable. When
Yeah.
you just take pills for every ill and never think about, okay, what's the long-term impact of this pill? That is it's not the truth. There's side effects to everything, not even medication, to, choices that we make. There are
Sure.
consequences to everything. And so we have to take ownership of that and take ownership of our life. And so that's, to me, a deeper spiritual connection of, like, we're all dissociated. We're all sort of
Yes.
going through the motions in life and have lost the joy and all of that. And so that's a huge piece of that I talk to my patients about, because most of them are severely disconnected with themselves and their body.
Yes.
And hence their body's talking to them very, very loudly
Mhm.
to get them to pay attention.
Yeah.
So there's a gamut of different types of people. Typically, people who see me, they have issues going on. Would I love to just be all preventative? Absolutely. And it's really what I'm trying to do in the practice that I'm at. But in general, we're a reactionary society. So.
Yeah, it's interesting because it starts so early. The allopathic or Western, whatever model you want to call it, what people are used to is relying on someone to tell them what's going on in their body. And we've talked about this before on the podcast and just in general. You divorce yourself from
100%.
from your body, and so there's such an anxiety when something happens because you don't have you've stopped relying on yourself to come up with the answers or to think clearly through it. So it's just like, as soon as something happens, the system has trained you to ask the doctor for help and to fix it immediately, versus what you're saying, with functional medicine and with holistic health, you start learning to rely on yourself. And it takes time, right? You have to unlearn this idea that you don't know anything about your body, which is completely false. And even as like little children, like the connection that little kids have to their body and the way they talk about when they have something that's wrong with them is so different from like an adult.
Yeah.
And like functional medicine, the way that, we've used it personally, and just holistic health in general, over time, the more that you're doing the simple things like, making sure you're cooking your food and eating healthy and moving your body and getting sunlight and all that stuff, the more you start connecting, like, oh, this makes me feel good. When I feel like this, I need to move more, or I'm going to feel this way or whatever. And even those simple things, I think it's just a whole different system of thinking about health than, and you're kind of not allowed to have it in the allopathic system, or not that you're not allowed, but it just kind of gets taken away from you. And also, not to say, like, there are such good things about having an emergency room for, so I'm not saying that's kind of what I was getting at earlier. Like, is there space for the two? Personally, absolutely. I think 100%, but I agree with, and have seen in my own life and lives of friends and family and stuff, it's like, it really should be the functional model is what should be the everyday, right? That should be your go-to. And really, it should be, the first line is like yourself. You should be doing a lot of this on your own. And then there's things to kind of help you through whatever chronic things are coming up. But those come from ignoring and just like you're saying, pill for every ill, kind of like asking, taking more and more medication.
Just being proactive versus reactive. And so when you have a connection to your body, in general, so let me just give you kind of a scenario of like a pretty typical patient. It's a woman, usually in their 30s, maybe early 40s, who typically hasn't been feeling great for a while, nothing major, but they go to their doctor. They usually go to a couple doctors because they're seekers. Women are typically ones to take action when it comes to their health. Men are typically slower. It typically has to be something pretty significant or someone to tell them you have to go, right? And so by the time they go, they maybe get some lab work or get a test. Oh, everything's normal. This is just, part of life, or you're anxious, you're depressed. And so while they're putting effort into try to get answers, they're getting nothing but like, oh, well, what you are experiencing isn't right, or it's not real, right? It's just the stage of life. And so you start like getting really discouraged in that, okay, what's going on in my body? I don't know. So you start, distrusting or not feeling like you really are the owner of your own body, like you understand it, right? And many women, they don't take that for an answer and they keep searching, and then they eventually find someone like me, right, who will listen, validate, and then do the right types of testing to understand and also assess lifestyle, right? There's a lot of things that are going on in the lifestyle that can be tweaked. And as we age, hormones and needs change. So the number of times I cannot tell you when I talk to someone and they just feel so validated and just immediately reassured that like they aren't crazy, right? Like what is going on? There's actually a reason, and there's also solutions to help support that. And so I would say the majority of the population do not have that experience. So it just continues to create this like distrust, this like dissociation from their body, and just kind of, oh, well, I guess I just got to keep going on. And that, as we know, eventually is going to continue to pile up with other things.
This is an interesting, so like the answer that you get, I think this is so common and not talked about very much, but what happens is you go to the doctor and like you're saying, you get a diagnosis of whatever it is, like your airway is blocked, or you have sleep problems, or you have anxiety. And the answer is, it's not even that they're telling you that you're crazy. It's not that they say that. It's that they say like, we don't know why this happens. It's always like, there's no reason for this. Like it just is. Whereas like in functional medicine, it's like, well, there's probably a detox issue or a nutrient deficiency, or you're not getting adequate sleep, and I think there's such power in knowing that things don't just happen to the body. Right. There's, and this when we talk about like a root cause,
totally,
like those are the root causes. I think that's a word that people probably hear and don't really understand, but it's like when you put food into your mouth, your body's going to digest and absorb and either be able to use the nutrients or not be able to use the nutrients, right? That's the basis for everything that happens in your body. And like, so when you're going to the doctor and saying, I have this pain or like bloating that's here, every single day of my life, and they're just like, well, take this pill and we're not really sure why. It puts people, like we're saying, you feel really, you don't feel validated. You feel like you're crazy.
Fear when you don't know what's going on. It's
and fear.
What's going on? Could something else happen that I don't know about? Yeah, absolutely.
Right. Yeah. So how would you say you look at kind of chronic disease? How is that different? How do you see kind of the pathway of that, and maybe talk about like, or thinking about like, I think people have symptoms, like we're talking about these little things, like maybe you get headaches, or maybe you, like bloating is one, things that come up that people maybe are not recognizing as something that they should react to, and they just start living with. And how does that kind of affect how you move down kind of the chronic condition path?
right.
from the functional
So, I
perspective.
mean, very much of what I do is extremely personalized. So it really, it varies. There's not like a standard approach, but I would say, fatigue is a big one, like just kind of resistant weight gain, like they can't lose weight when they used to, digestive issues. So like irregularity in bowels or bloating. And that typically presents itself over time, can present itself in like low thyroid issues or, headaches or really skin issues, or another one, hormonal changes. And so how I look at it is really we get a history and we tend to do more comprehensive testing. So you got to get information to really validate with symptoms, right? Neither one is sufficient alone because labs are fallible. They vary. They're very dynamic. So I tell people within a week, these values can change somewhat substantially depending on what we're testing. But it's information with symptoms where we're able to really understand and how to prioritize a plan. And so we do a lot of different types of testing, but I usually always start with serum. And the thing is when we look at sort of the traditional allopathic, the information they're getting is just not enough. It's like they're barely testing anything. So they're not getting the right information to help them figure out the solution or the diagnosis. And in reality, the diagnosis doesn't really matter.
Right.
No one with a diagnosis ever said, oh, wow, I'm instantly better because now I have diabetes. If anything, it's like shameful. Yeah. It makes you feel like, man, I've got all this work to do. So when we are in, what we're taught in Western is diagnosing and treatment, right? And so how do we diagnose different conditions? And what we're learning is that there's a lot more conditions now that don't have a diagnosis. We don't have a way to diagnose. Autoimmune disease, for instance, like the number of people who have autoimmune inflammation without a name to call it. That is like rampant, and we know why, because it's environmental toxins, it's gut issues, it's stress, which can be from toxins, come from our environment, there's many nutrient deficiencies. And so those are very much root cause things that are causing issues in the body, but we in the traditional system are lacking in being able to have a name for it. But in reality, what is the supportive of all that? It's the foundations of health. Like it's making sure we're opening up detox, eliminating or reducing our toxic exposure, which is extremely hard. I mean, we have a limited number of things that we can actually, control in our environment. There's a lot of toxins and things that we're exposed to that we can't, but we need to do our part to learn and reduce it as much as possible. And so that's a big one. Gut health and toxins are very much the driver of inflammation and immune disruption, metabolic syndrome, all of that. And so those are really foundational to health issues that start manifesting in symptoms, right? It all starts brewing underneath, and then we have sometimes a triggering event, like I get sick with COVID, or I was in a car accident, and then all these symptoms started. Well, a lot was brewing underneath, and it just needed something to flip the switch. And that's what we see, and then we're working backwards and doing different things to support it. But
and there's like this from the patient and the provider, it sounds like you want to come up with this diagnosis of like, okay, you have this or you have that. And what I'm hearing you say is, well, sometimes it's such a complex scenario that it's not like this one diagnosis where there's a diagnostic code that generates all this, like, treatment plans and reimbursable procedures. It's like, it's more complicated than that.
And diagnoses, a lot of them are based on the insurance of coding and reimbursement, right? Diagnoses are not, well, yes, I mean, I'm not eliminating the importance of them, but we rely heavily on having a diagnosis for something, and people are searching for, well, what is it that I have? When really we should be focusing, okay, well, what is unbalanced that we're seeing in the testing and history that we can start working on, so that diagnosis is somewhat mute.
Also like working, I think a lot of times the message people get is, I have this and I'm going to have it, rather than like, you have this collection of symptoms, and so if you support it, those will go away, and then it's like maybe you don't really have that thing, or or it doesn't have to stay,
it's
I guess.
not controlling your identity.
Right.
Your identity is
Right.
not diabetes. It's
Right.
not PCOS. It's not, the myriad of diagnoses that we have, Hashimoto's things.
Mm-hmm.
Those are those are things that are going on in your body and are real, but they're the name itself and the diagnosis isn't necessarily helpful.
Yeah.
And it doesn't have to be static.
Exactly.
I think that's the thing.
Yeah, when I one of my big takeaways as a provider in my life was when I worked in a hospital.
Yeah.
And like you, it was like, I never want to come here.
Yeah.
Like, you know, and I feel so bad for the people that get stuck in here.
Mm-hmm.
But one of the most striking things was the way that you write your notes, like it's an electronic health record, funnels you down this path. They're very systematically programmed to encourage you to put in your findings. It almost pushes you down a path of like, okay, so here's the algorithm. You entered all these things, so here's your diagnoses that you can pick from, and then here's your, it like almost encourages you to go down a path in that model. And something I saw yesterday was Chat GBT for doctors, which is like,
I haven't seen that one.
Yeah, I saw that.
I should.
It was targeted at me. I was like, oh my gosh, I don't even know how to feel about this. But like in this conversation of, well, it's hard to like always give it a name or a diagnosis. It's like, and I almost I thought about it and I almost saw it as an alternative to like the electronic health records providers have been using for a while. Is like funneling you down, get this diagnosis, here's your treatments, towards maybe even a faster route that way.
Yeah,
right?
so you can see more patients then, and just have the computer. Yeah, I don't know how I feel about all of that, but it's definitely and I'm not saying that diagnoses are bad, because it is helpful to know how to treat and support. But my first line is not a pharmaceutical, but when we have diagnosis system, the first line of care is really a pharmaceutical versus all the other things at the base before you get to pharmaceuticals and surgical intervention, which are still things that I use and I recommend to some of my patients, but not until we can't jump ahead.
I have a question for you, because I want to learn about your practice. I haven't been to see you yet, but when you typically intake a patient, is it standard over your practice to do like lab work and blood work? You said serum and
yeah. So typically we have usually an hour to 90 minutes with the patient, depending on the type of program they're doing. And everyone's getting serum testing.
100% of the time.
Yeah, pretty much 100%. Then oftentimes we're doing stool testing, environmental toxin testing. I do a lot with mold illness, so I do mycotoxin testing, and then oftentimes hormones. But I would say gut testing is by far one of the biggest things we tend to just oftentimes start patients with, along with serum at the beginning.
What's the like average frequency at which you like would retest someone that's like in your care and going to stay in for a while?
Yeah, so it depends. If it's like someone like y'all who are really more preventative, right? You want to get the right information once or twice a year to make sure you can gauge lifestyle and supplementation. So normally 6 to 12 months. I usually see all of my patients twice a year, even the ones that are sort of rocking and rolling, right? I'm usually prescribed. I have a lot of patients on bioidentical hormone therapy. So those are prescriptions that we need to check in. So normally twice a year. But in general, if you have a lot of chronic stuff that's going on that's really impairing your life, then we typically see you more frequently at first. So every month, every 1 to 2 months, and we're oftentimes doing testing. Maybe not every month, but certainly every 3 months is a really pretty good cadence. If we're titrating thyroid medicine or things like that, if we're trying to get dosing right, then we do sooner. But I would say I don't typically recommend a lot of blood testing more frequently than every 3 to 6 months.
And earlier you had mentioned how sometimes there's variability in the lab test, and I like sensed that. I don't know, again, to like a layperson that doesn't do this, like, is it common that you get labs and you have to ask yourself, okay, are all these values reliable because there's variability?
I don't typically have to do that, no, but I have over the years the labs have like repeated the same test by accident on the same blood draw, and it's kind of shocking how it can be 1 to 2 points different on the same draw.
Yeah.
And then I've had, again, this is why you can't look at blood work static, like alone. It has to be with the symptoms. So I've been doing this long enough to kind of know, if I see a weird lab where I'm like, this doesn't look right, I'm more inclined to, because it's not matching with the symptoms,
Right.
I'm more inclined to say, let's just repeat and
Mhm.
see versus starting to treat based off of that.
Yeah, that's fascinating to me to understand.
But it's not, I wouldn't say it's every day, but it's
Sure.
happened enough where you have to think about it. And so blood work is great to assess acute processes. I also do a lot of hair tissue. I do a lot with minerals and hair tissue mineral analysis,
Mhm.
which is giving me a much different type of information that's looking much more over time. Right? It's looking at
Yeah,
patterns
it's
over time.
like a 1 to 3 month window.
Yeah,
so
2 to 4 months usually.
Yeah.
So it's just a different lens to look at. And to me, having different types of information, genetics too, like different types of information based on what's going on with the patient really allows me to personalize and customize and kind of really truly understand what's going on so that we can make a plan from there. And so testing is typically more upfront till we kind of understand. And then once we get going and things are moving in the direction we like, it's oftentimes a lot less frequent.
So blood work, I want to stay on that for just a minute
Yeah.
because I feel like this is so common.
Mm-hmm.
People get blood work at their annual physical or because they think they're having symptoms. And so they run to their physician,
Yeah.
get blood work, and the physician says everything looks normal. And they're having all kinds of whatever it is. And they feel nuts because they're like,
Yeah.
I don't feel normal. And then if they're lucky, they go to a functional practitioner who then reads these exact same blood work and is like, this isn't normal at all. Can you speak to that a little bit?
Yeah, so it's really about, we're looking at optimal, not like in range or out of range. And so the way lab ranges, so when you get a lab, you'll see the number that's you, and then usually to the side, you're going to see a range of normal. So if you're within that range, you're normal. Well, how that range is actually created is not necessarily that we know the right number of function. Like, it's based off of everyone else getting labs. So you're being basically compared to a population that is going to getting blood work regularly. And what are those people?
Sick.
Normally sick. We have a very sick society. So I don't know about you, but I don't want to be compared to someone who is sick as that being my standard of okay, right? And so when we look at lab work, we're really looking at optimal ranges, which tend to be a lot more narrow, right? Thyroid, for instance, is a big one that's changed so much. And also when it comes to the way they don't get all the information, right?
Yeah, they're not taking like the wide
full
range of tests.
thyroid
they
panel.
take like
They do a
panel.
TSH, maybe a T4, and that's it. Maybe thyroid antibodies, but I cannot tell you the number of people who haven't even had antibodies tested and they've had Hashimoto's for years and never even knew it.
Yeah.
They just got put on thyroid medicine and that was it. So it's about how they look at it. We look at optimal ranges, and then it's also the right amount of information, which in general is much less. It's like a CBC, which is a blood count that looks for acute infection or premature infection, right? Anemia. So it looks at red blood cells and hemoglobin and hematocrit. So if you're bleeding out or you're super anemic, it'll kind of show from there. CMP, which looks at some electrolytes, kidney function, liver function. For those to be off, there has to be some major stuff going on. It's going to be more likely increased during acute processes. So again, it's not giving me any information about like actual liver function. It's just acutely it's working pretty well. And, then maybe they'll add a cholesterol panel, which again, it still only looks at cholesterol, triglycerides, LDL and HDL. Well, we know there's a lot of other advanced cholesterol markers that give us a much better look at what's actually going in the vasculature. Because cholesterol is where we get all of our hormones from. So if we don't have enough cholesterol, we're not making pregnenolone, and then we're not making progesterone and estrogen. And, so these are all important things of information. And so that's a pretty standard. They very rarely check vitamin D, which, as we know, is like hugely important for mental health, immune health, bone health. I mean, like, let's just say Alzheimer's. I mean, the number of research on vitamin D level and autoimmune disease, and it's very rarely checked because insurance doesn't always cover it. Again, it's driven by, but that's about it. You're getting, maybe an A1C, which looks at your blood sugar over 3 months, but not normally. So the amount of information you're getting, a TSH, CBC, CMP, lipid panel.
Yes.
You're fine.
And what happens,
That's
it's scary because you know, it's like he used to do this. He would go to the doctor once a year, and he would be like, I'm going to get my blood work every year. Like that was his, and he would walk in, you know, he's like fit and he's not overweight. And, I mean, at the height of this, he was like working 3 jobs. We had little babies, and he was getting blood work, and they were like, yeah, it's a little bit off, but like, you look good. So, and there was, what happens is over time, if you're told that you're fine, you know, and then you just continue on doing exactly what you're doing, those levels get worse, right? And then some other symptom is going to come up, and it's just dangerous.
Well, that's where we're looking at the optimal range, because I tell people too, they're like, oh, I'm healthy. Why should I get blood work every year? Mm-hmm. And we oftentimes can see subtle shifts if we're getting testing every year, mm-hmm. subtle shifts in your chemistry. Like, where do you feel your best? When you feel your best, that's when you should get blood work done. Because we know what your baseline looks like. Yeah. And so as things change each year, we could say, oh, well, it's been a really stressful year. I've been working 3 jobs. We're like, you know, trying to make our business, and we're doing all these positive things. And I say, oh, well, you know, your inflammation marker's looking a little bit up, or your hormone levels have dropped, or DHEA. And so we can talk about, okay, let's make some lifestyle changes, maybe add some supplements in to support the environmental or the stress now, and just monitor. And so that's a lot of what I love doing. Again, I don't typically have lots of people who are feeling great and wanting to get, you know, managed. We have a lot more people now that are wanting to do that, but that is really when people should come.
Right.
That's a great point, to have a good understanding with someone that understands this type of health practice, to know this is your optimal baseline when you felt great. It's like such a paradigm shift to what I think everyone has done.
Yeah.
Yeah, we don't need a lot of, I mean, we need standard information. You need someone who knows how to look at the labs, right? And but it doesn't take an expert in the field to be able to support you in the way that you need to be supported.
Yeah. Thinking about, we've kind of talked, I know, like, I feel like there's an awareness in terms of like chronic things coming up in functional medicine. Like, I think for people who are aware of functional medicine, like that is a connection they've made. But just in terms of thinking about kind of holistic health in the body and where functional medicine would play a role, because, you know, we talked about that being as like, it really should be like your baseline of care. What about like when I first got into holistic practices and nutrition and kind of understanding the body and like flipping the paradigm on its head for me, it was easy for me to get there and understand for chronic conditions, like things that were not going to kill me, right? Or like make my life just completely miserable. But what about these bigger things? So like cancer, MS, Alzheimer's, Parkinson's, like a lot of the neurological things. Is there a role, as we've been talking about, I think it's like you want to prevent, right?
Yes,
and I
absolutely.
think understanding, you can talk more about this, but understanding that like you don't get there out of nowhere. It's you're really marching down the path with these other chronic things. That's one thing. But then also, is there a role that functional medicine plays in either reversing or supporting through some of these things that just standardly, I think people think like once you get to that, it's like it's only surgery, it's only chemo, it's only like whatever the medication is for like MS or those kinds of things. What is the role that functional medicine plays in that? Like, I guess preventative, and then also kind of once you've been given the diagnosis.
Well, preventative is really just the foundations and getting support, looking at genetics, etc. When disease manifests in, you know, more serious like cancer, MS, neurodegenerative disease, there's a huge role that functional medicine still plays, even if you decide, which I'm not discouraging treatment or medications for that, depending on the person. So there's no, you know, again, it's completely personalized, and we do have integrative and whole, you know, integrative cancer experts that really focus on that. But regardless of whether you're given that diagnosis, there are so many foundational things, again, within functional medicine that can be very supportive to that.
Mm-hmm.
Is it curative? It's hard to know. It's
Yeah.
so complex by that point because there's been so much underneath that's been sort of driving that diagnosis.
Right.
Okay. So neurodegenerative disease, for instance, like Alzheimer's, type 3 diabetes, metabolic syndrome, right? Hugely impactful. If you've already started to see symptoms, that can be very challenging to reverse, but we can absolutely prevent progression, right? And that's where lots of different modalities to peptides, diet, as well as even none of the medications for Alzheimer's actually do anything, right? We've learned, they've thought they've known about what causes Alzheimer's, and so they've targeted drugs to that, and they've realized when the drugs work, but it's not curing Alzheimer's. So there's still so much within the brain. My dad's a neuroscientist, so so there's so much about the brain that we know nothing about, but we know about metabolic syndrome, we know about inflammation, and that drives a lot of that, right? So it's looking at these big macro things when it comes to cancer and MS. And so low dose naltrexone is another one that we use a lot within those diagnoses. So functional medicine is absolutely supportive. Curative, reversing, those are big words that need to be, looked at individually because there's no blanket promise. But when you just go for treatment of MS, for instance, with some of these medications that can have some significant side effects, certainly cancer, etc. It's, we can do chemo, right? And many integrative cancer do say there is chemo, we need surgery, etc. But again, we know cancer is recurrent. You get one cancer, maybe it goes in remission, and you get another. So what's fueling that?
Right.
Yeah. So maybe we can't, cure this cancer that's showing up, but we sure as heck want to do what we can therapeutically to treat that active, and then we want to work on the body to not continue to drive those, cancer cells in other parts of the body.
On that note, how many times have you heard, anyone probably can relate to this, you hear of someone that gets cancer and then it's this, they get it again, right? Versus someone that lives another 30, 40 years very happy and healthy. And so it's maybe these changes in lifestyle.
Yeah, and there's a lot we don't know. I mean, there's people who smoked a pack a day and all that, and we learned those people were doing fine with COVID. People, smoking actually was surprisingly, because of the nature of nicotine and whatnot we're learning about COVID, was actually not a death sentence. So, and there's people that live what we would consider, pretty unhealthy lives, yet they're living really long, happy lives. So there's things we just don't know, and, blue zones, for instance, like learning about those are oftentimes third world countries, right? So they do not have the advancement in healthcare that we have, yet they're living long, happy lives. So there's a lot we can learn about that. But when it comes to cancer and the, Alzheimer's, Parkinson's, for instance, is an environmental disease, we've learned. It's not genetic, right? So it's driven by environmental toxins that are presenting, as neurodegeneration, right? And motor neurons. And so again, if we understand that, how do we address that? So
I want to bring up something that's maybe very common and get your perspective on it. So let's say in your practice, we have somebody in their 60s, 70s, is on a statin, on blood pressure medication, has chronic pain, maybe another prescription or two. In your practice, have you been able to, make assessments and work with people and get them off those prescriptions? I think this is like a very general,
absolutely.
Like some examples of
those are really common.
How long does that, just an example of maybe this one you can think of, it took about this long and this is what we did and this is.
Yeah, it depends. I mean, polypharmacy, so by the time you get into your 50s, 60s, you're usually on a couple medications, and statin and blood pressure are pretty common, so we can speak to that. That's when, again, statins impact cholesterol, right? And so if we understand advanced lipids, right, so oxidized LDL, myeloperoxidase, plaque, some of these words that you don't need to know, but there's a lot of advanced lipids that let us know, okay, actually you have some risk. You have intravascular inflammation inside the blood vessel. We do a calcium CT score, which is sort of an image to look at plaque buildup. Potentially it's calcified plaque. We have better technology now through AI to do a calcified and non-calcified. It's called a clearly. It's pretty expensive, but I definitely do that on patients to differentiate the type of plaque. Soft plaque is much more volatile. It's easy to break off, and we're going to have an event. Calcified plaque is stable. We used to have cardiac events that were caused by stenosis, meaning it's just occluded. The reality is we're not by calcification. The reality, that's not what we're seeing. We're seeing soft plaque rupturing. So again, it's getting the right information. So a lot of my patients who just get put on statins, typically women, as women go through menopause, their cholesterol naturally increases because estrogen is protective to the heart and cholesterol. So it's very common to see women as they go through menopause, so their cholesterol go up. So what does their doctor do? Put them on a statin. We also know statins impact risk for diabetes as well as neurodegenerative cognitive issues. And so that's an issue we need to think about, right? And so if their advanced lipids look good, their CT calcium score is 0, I'm going to take them off the statin as long as they're okay with that. We inform the patient because ultimately who is in charge? The patient. They have the right to say yes or no. They go to a cardiologist, they're feared into feeling like they don't have a choice. And so everyone has a choice. It's your life. You have to be informed by it and take the responsibility. But yeah, that's a big one with the cardiac. And there are people that I have with normal cholesterol levels, but we do cardiac advance, and it's horrible. They have a lot of plaque buildup. So yeah, we might put them on a statin. I also use PCSK9 inhibitors, which are better, something like Repatha, Praluent. These are injectables. So again, there's ways to address it, but there's a lot of people who have normal cholesterol levels who are dying from heart attacks. So it is not just looking at those numbers out of range. So I can get on a soapbox on this because I cannot tell you. There's like one cardiologist in Austin that actually does Cleveland or Boston Heart advanced lipids, which is to me deplorable. This is evidence-based. There are research behind these levels. It's just not being done. Blood pressure, again, such a lifestyle issue. Are they overweight? How are they sleeping? What are their nitric oxide levels? Magnesium, calcium, potassium. I mean, so many things. Stress levels, caffeine. There's so many things that can drive it. Minerals, that's why I look at minerals too, because again, when you start optimizing that, then their blood pressures can be normotensive. Do I take someone off who doesn't have controlled blood pressure? Absolutely not. But we can play with it and titrate off. Versus, hey, you have high blood pressure, take this for the rest of your life. There's nothing you can do, right? Like, it's about weaning people off. It's not like, this is bad, we're just going to take you off. No.
Well, and
it puts them at risk.
Right. Well, but also that is ignoring the things that, like you're saying, like maybe you're overweight, maybe you're not sleeping well.
Yeah.
Like if you're not
Sleep apnea is a big one.
Right. If you're not addressing those things, then that
Big
stuff
time.
will just, the medication may control the blood pressure, but it's the other things.
Well, most likely the blood pressure is going to need another blood pressure medicine to control it over time, because again, it's now I'm on 2 different blood pressure medicines and a diuretic, and again, the medications aren't necessarily the problem. It's the fact that we're relying on them for everything. When in reality, it's like there's a lot. Again, our body is sending us signals, and if things are off, it's going to still send louder signals, which is going to need another medication. You know what I mean? You see what I'm saying? Like, the body is very powerful, and it's very able to be in homeostasis, and that's what it wants at all cost.
Right.
And so that is, that's what I see. And so I love working with kind of cardiometabolic stuff, because there's a huge change you can make in people, even in the elderly, and it's small things.
When you've gotten people off of these medications and they've been willing to maybe like slowly improve their health and slowly wean off the medications, what kind of like responses would they give you? Like, what do they feel? Do they feel a difference?
Oh, yeah, they feel, because of course they do. Like, they feel, first of all, they feel like pretty empowered that they're off medications. People don't want to take medications in general, so they're like so happy. But yeah, they're typically feel much more vital, more energy, better mood, things like that can be. Another one is PPIs, or like Nexium or acid blockers, right? That's another one I can go on a soapbox about. But it's like, oh, I have heartburn, or I just need to take an acid blocker forever, which literally neutralizes your stomach, and then you're really at risk for bacterial infections because it's not killing anything. and micronutrient deficiency, because if you don't have acid in your stomach, you don't digest.
Right.
And then it goes into your small intestines where everything's absorbed and there's nothing to absorb because it hasn't been digested.
Yeah.
And so it's like just a lot of stuff that can go with that. And so it's knowing about the gut. Again, if there's infections or if there's a hernia, that's the hardest, right? Because that actually impairs the stomach from closing. But that's a very rare circumstance. Usually it's a lot we can do with nutrition, probiotics, enzymes to kind of get that stomach acid balance back. And then we pull off the acid blocker. So it's really used for acute situations, but have been abused. And now you can buy them all over the counter and people don't think twice. And then they can have some pretty long-term issues with it.
Masking a symptom
Oh,
can
yeah,
be
big
a really
time.
dangerous thing
Yeah.
to do.
Yes.
And I like just to comment on this as it relates to dentistry and oral health. It's a real tragedy. Oral health has just been like separated from all this. And even I was going to ask you, even like someone that's practicing functional health like yourself has been in integrative practices. How often is like oral health assessed?
It's in my every assessment. Yeah.
That's
so we ask
awesome.
about oral health, dental health, root
we could
canals.
ask like, how would you assess someone in a functional practice?
Yeah, so we ask about their dental history. So cavities, crowns, root canals, if they have amalgams or not, wisdom teeth, things like that. And then general oral health. So if they have bleeding gums, things like that, gingivitis, stuff like that, because we know that the mouth and the gut are very interconnected. And so we're going to see dental issues because of that as well. And so, but root canals too can be very much in cavitations, like within the sockets of the wisdom teeth, can oftentimes be a big driver of chronic inflammation and low-grade infection, which is constantly stimulating the immune system. Not where they feel bad, but again, it can really trigger that autoimmune cascade that we see.
Just to add a layer there, I think that a lot of people will wonder, like, well, how do I get assessed? Maybe my dentist doesn't, I don't know how to bring this up. And something I've just heard over, I think is a valuable tool, is any dental patient could ask for like a 3D cone beam x-ray and have a radiologist interpret it to look for, specifically asking for areas of chronic infection that maybe are visible on that type of x-ray, in addition to what like they would find at a clinical exam with bleeding gums or cavities and things like that.
Yeah, and we have several like biologic or integrative dentists in Austin and Marble Falls that we'll refer to, because I don't do, I just assess and then I say, hey, you need to get that looked at and taken care of.
It's cool to hear the value you place on it.
Yeah, it's super inviting. Well, the meridians are so amazing. So looking at the mouth and the meridians of what tooth, a lot of the molars are all like large intestine, small intestines, it's all of that connected. Yeah. So it's pretty cool.
So I think, as we've talked about a lot of ways that you can treat with like testing, supplements, all kinds of like really specific treatments you do as a functional provider. But like, if we talk about functional medicine as kind of like should be the basis of healthcare, kind of, that should be the foundation rather than the acute care system, or the allopathic system. What are some things that you would say are like the foundation of that, like even before you get to testing? Because I think what gets lost in this is that the whole goal is to really empower people to take care of their own health, right? It's not really about like go from allopathic to functional, because then it's just you're kind of training yourself to think that you need someone else. It's really the goal is really in all of this is to like empower you to understand that there's so much you can do to be preventative and just to like improve the way you feel. You don't have to like march down the path of life and just feel worse and worse and worse and worse, which is what I think a lot of people think, that it's aging and whatever else. Like my parents felt this way, so I'm going to feel this way. So what are some, like, I don't know if it's just being like not spending money. It doesn't have to be that necessarily, but what are the basics that you start with like every patient really?
Well, I think of it as like health is a way of being. It's not just
Yes.
like, oh, I'm doing a protocol, I'm doing healthy things right now. It's really just, it becomes a way of being in your life,
Yes.
right? And so oftentimes when we jump too soon to testing, we oftentimes are quick to want to jump over foundation. So for me, the things that are so important are eating to support stable blood sugar. So blood sugar dysregulation, insulin resistance, metabolic syndrome is literally rampant in our society. And so people understanding how to eat to support stable blood sugar.
Can you explain, like, I feel like we're like in this world,
Right.
but like metabolic syndrome, can you just kind of give like a little bit of a brief overview of what you're talking about when you say that?
Yeah. So metabolism is energy, right? And it's the use of how we use in energy, and energy can either be created or destroyed. So it's all being sort of adjusted, right? In cellular health, like mitochondria. But when we think about metabolic syndrome, when we think about energy, we eat food, our body breaks it down to glucose, which is then utilized by the cell. A hormone, insulin, is needed to be released by the pancreas to allow glucose to be entered into the cell and to be utilized in different cycles, right? Mitochondria, et cetera, to produce ATP. Right. And so that pathway is critical to life. Like if we do not have insulin, type 1 diabetics who do not produce insulin, they will die without insulin. So that process is very efficient. So we have a certain amount of insulin when we eat that is released based on what we eat, right? And so if we eat things that are high in sugar, our body's going to need more insulin to put that into the cell. And as we eat, if we eat healthy foods that are, macronutrient balanced, so proteins, fats, complex carbohydrates, the body is going to be able to utilize that with as little insulin. Insulin is a hormone that has side effects. We have too much of it. If we have too much insulin, we're going to want to gain adipose tissue because, again, the body's like, oh, we have a lot around. Let's go store some for later, right? It can cause sluggishness, fatigue, things like that. When you feel, maybe when you've eaten like, an ice cream cone and you like want to take a nap afterwards because you're like, whoa. And as we become more conditioned to a healthy lifestyle, when we eat sugar, we feel it a lot more.
Right.
Standard American diet is really all sugar when it comes down to it. All of these simple carbs and processed foods are just glorified sugar.
What is the standard American diet? I just said this in front of someone recently thinking it was just something everyone knew, and she had no idea.
It's basically processed foods that are not really, they're as far away from what real food looks like.
Right.
And so people aren't eating like fruits and vegetables in a day, to be honest. They're eating processed meats. They're eating things that are fast foods, which are, pre-made with the crappiest ingredients, frozen, shipped around the country, right? So you're just not eating fresh food. They're very nutrient poor. Yeah, it's dead food. And so when that pathway insulin is being released, the cells start getting numb to all the insulin, and our body needs more and more to do the same processes. And that's when we have a lot of dysfunction in our metabolism, as well as like that can cause really widespread issues.
Yeah, as an adult, I think many adults would say you get kind of numb to you're on the standard American diet for a long time, and you kind of like, that's the rhythm of your body. But then if you have kids and you watch little kids, and then you get to like take them to the birthday party or whatever it is, right? And you watch your kid is having a great day. They're feeling good. Their emotional state is steady. And then, and then it's like maybe a cupcake at the end of the soccer game. And you're like, oh my God. One of our friends the other day was like, my kid turned into a psycho after that party.
Well, it's like the food dye. It had a bunch of artificial coloring, and then they're just...
Yeah, the kids are very reactive to their environment. They're also very quick to go back to homeostasis.
Yes.
So they tend to have a lot lot of extreme symptoms, but then they can go back. Humans, we have less adults, not humans. adult humans.
Kids are monsters.
Adults, we just tend to have less of this extreme symptoms. And so you can be on a standard American diet and it kind of becomes your normal. So normal is not optimal, right? And so when we clean it up, we can really improve that metabolic pathway. It's not broken forever. And that's the thing that I want to stress to people, that you can have, metabolic dysfunction, but it is extremely reversible with lifestyle and other interventions, depending on what's going on.
These ultra processed foods that we're kind of talking about right now, I feel like the danger of these foods is just not stressed enough. I'll never forget working in like a lower income area in Texas as a dentist and walking into a practice and, what's up with the orange cavities here? Why is the decay orange colored? And it was spicy Cheetos were like the thing. And literally like everyone's eating spicy Cheetos, right? All these kids at school, they can get them at the school cafeteria that was there. And it's like, on the packaging, it probably says it's, got these beneficial vitamins and minerals added to it, but it's literally like rotting their teeth out, but and also wrecking their metabolic health, right? As a dentist, I'm just seeing the teeth rot out, but like that's just one part of the equation.
Yeah. Okay. So food, essentially is what we're talking about. Food, blood sugar regulation.
Blood sugar regulation is a big one.
Those are things that people can do.
Sleeping, getting outside, like circadian rhythm is really our body operates in a 24-hour cycle. Women, we're not going to get into that but in general, we have hormones that help wake us up and help us go to sleep, and they're driven by the cycle and the sun and the moon, right?
Yeah.
And so we live in fluorescent boxes. So our body is very confused by that. And so we need to be getting outside in nature as much, really ideally in the morning with sunrise and then in the evening with sunset, and try to minimize the amount of like blue light which is coming from screens and LED lights and things like that. It's really hard. I'm not saying that it's not about perfection. It's just about, first of all, awareness and doing the best you can with the information that you have. And that's where I think people need to just take a breath and do the best they can, and as they start making changes, other ones come in easier, right?
Right.
So that one's a huge one. Moving their body is huge, and it doesn't have to be like CrossFit or major weightlifting or things like that. Just like staying active throughout the day. They say in general 20 minutes of exercise doesn't take away from sitting all day, right? So we need to try to just be active as much as we can. And then certainly weightlifting, et cetera, like that. We know the benefits of that long term for many, but in general, just move your body if you've been sedentary. And then optimizing sleep. So we need to be getting to bed before midnight, certainly ideally 10, because between 10 and 2, we get the most deep sleep. That's where we get our deep sleep. Deep sleep is when we do all of our regeneration, stems, all the things, immune system, all of that is really being restored. And so if we wait too late to go to bed, we're going to notice, first of all, you get a second wind, right? Those are those stress hormones that being released. And then you're like, no matter how much sleep you get, you're just going to feel tired the next day. And that impacts blood sugar. So it's really hard to have stable blood sugar when you're going to bed too late and not getting enough sleep, because those stress hormones are keeping you going, right? And normally the healthier you are, the more robust those stress hormone pathways are, and that's how they should be. And then relationships, connection, community. So that to me, is honestly medicine in itself, as we know.
100%.
And that is COVID in general as a society, even as family units, right? We're just not in community. We're not supporting each other and being supported. And that's very much, that doesn't send signals to our body of safety. And when our body feels safe, it can heal, it can do all the things that it needs to do. In general, we live in a body where we don't feel safe, even if intellectually we don't think that. Our body can feel that. It's a very primitive. And so that is, so hugely impactful.
Yeah.
So nature, community, those are major foundations. And then ensuring that we're eliminating, trying to sweat, making sure we're pooping every day, and minimizing environmental exposure is huge. So there's so much that you can do and really should before you even get to see me, because oftentimes by the time you see me, there's things that are even better before you've even, you're like, oh, I started changing my diet and this went away. And so by the time you get to me and we talk about history and what's going on, we've done a lot of those foundational steps, which I'm going to talk about anyway, and want you to do.
Right.
That oftentimes by the time you get to me, things have improved, or if they haven't, then that's information for me, right?
Right.
Yeah.
Just I think sometimes functional medicine, just like you said, there's an upfront cost and more time, but the truth is, like, so many of these things can be done. Not necessarily maybe buying food costs money, but it's like you can do a lot of this on your own, and that's going to be the foundation of what you need anyways moving forward. So a lot of it is accessible even without testing and all of that stuff. And also on the relational piece that you were talking about, I think it is so interesting, like even just the fact that when you meet with like in the functional model, the first time you meet, you're meeting 90 minutes with someone, you're creating a relationship, versus like when you meet a doctor for the first time, it's like 5-10 minutes. You know, even just that, like the safety you feel and the validation you feel,
it's huge.
That in and of itself will help you heal. Like having someone
trust.
believe in like like having the reflection of belief that you can get better from someone else is really just healing.
Yeah, I mean, we know about consciousness. There's, Dispenza and all this, right? It's like where you put your thoughts and intention, you know, energy flows, right?
Right.
Where the mind goes, the energy
flows. Yes,
and so it's just really important to remember that. And anything is possible. It really is 100% possible. 100% of the time if we believe and stay open. And so instilling these sorts of things in people and talking to them about that, it's not medical, but it is. It's about health and vitality. And again, it's about a way of being. So the idea is I really don't want you to have to see me intensely forever.
Right.
And if I can get your trajectory off of back to the more positive, right, then that's going to serve you well and be preventative in and of itself.
Yeah.
And that's really, it reduces stress, it reduces healthcare costs, all the things, right? So it is an upfront investment, but the idea is it's pulling you off of a path that was going to cost a lot and not just money.
Oh, it'll cost way more for sure.
Not just money though. It costs your mental health, your life. Right?
Yeah, 100%.
And that's what we're about. It's like impacting, elevating and empowering human health. And that's definitely infectious to anyone around really healthy, empowered people.
Yeah.
Literally they're magnetic.
Yes.
You want to be around those people and you want to know you want to have what they're having.
Yeah.
Right. And so we need more people like that to be leaders in health. And it's not just about getting testing. That's one piece of it.
Absolutely.
It's a lot more than that.
Yeah. Cool. Well, this has been such a good conversation, and you are one of those magnetic leaders, and we love that we know you and got just like destiny made us neighbors years and years ago.
I love it.
And like, what a cool, this is just one of those moments I feel like where life just like circles back and we live in different neighborhoods and we're not in the same kid schedule anymore, but we've like come back together in this,
really beautiful.
In this, this magnet, it brought us back together for this, which is like been so fun. And
totally.
Thank you so much for being here. And what I know right before we go, like you were talking about some things that you have coming up. Tell everybody where they can like find you and what other, maybe if you're going to be doing more podcasts or I know you have kind of a women's program coming up.
Yeah. So I see patients one-on-one, and I'm also the director of the functional medicine clinic at Alive and Well Austin. Well, we have now 3 locations. So it's a wellness ecosystem in Austin. So I see patients there, as well as we have a lot of really amazing clinicians that work in functional medicine. So that is really where you can find me from a clinical standpoint. I also have a women's program, which is a virtual sort of 4-week program, really helping women understand their hormonal health and how to support it. So it's a lot of these foundations, just really more nitty gritty and detailed, as well as really focused on the female menstrual cycle and like how to support it and understand it. And that includes testing, etc. So it's kind of a standalone program. And then I'm hoping to do different types of additional offerings, retreats, etc. Community building is a big one that I'm looking to do. So
cool.
I'll keep you updated.
Perfect. Thank you for being here. This has been such a good conversation.
Yeah, I learned a ton, so I appreciate you.
Thank you so much. It's been an honor. I'll come anytime.
Yeah, we're definitely going to do it again because I feel like there's 1,000 topics we could. We got to get into fertility and birth and all the
that.
things.
Oh yeah, we got to talk about birth,
hormones and men's testosterone, and we're going to go all over. Cool. All right. Thanks for being here. This episode is brought to you by Yin Fang toothpaste. Yin Fang toothpaste is a 4-ingredient toothpaste with coconut oil, baking soda, cacao butter, and nanohydroxyapatite. It's non-toxic, there are no preservatives, it has low abrasivity, which preserves your teeth, it supports your oral and gut microbiome, and it's remineralizing. We ditch the tubes to help the planet, and instead, Yin Fang comes in a sustainable zero-waste packaging and delivery system. Get yours at yinandfang.com.